Hi, this is Dr. Kash, Medical and Life. So we have a patient that came into the hospital, rather bradycardic, heart rate was low, appeared to have a complete heart block. And so he was having some fainting episodes, so we decided that he needs a pacemaker, which we put that in, which I'll show the picture a little bit. But this is a chest x-ray prior to the pacemaker. And the point of today's video is to show you what a pneumothorax looks like, or an air leak as a result of a procedure. This is a plain x-ray showing the right lungs, and that's the left lung right there that I'm pointing. You can see these little streaks. Black is good, black is air. So after we put the pacemaker in, that's the device right there on the left side right there. On the right side, you can see that the lung is still pretty well expanded with those little white streaks there showing lung tissues and a little bit of scarring and such. But on the left side, right under the, past the pacemaker there's an area where it's nice and black and smooth. You don't see those little streaks anymore. So that means that the lungs has collapsed about 50%. Most of the lung tissues are under the pacer there, but the upper portion is just air inside of the chest cavity there. So that's why it's nice and black and smooth. Let's see if we can zoom that in a little bit. Now zooming in, we will see that, let's see here, there we go. Yeah, compared the right to the left, which is to your left, and then to my right there. Again, right under the pacemaker, that area is nice and smooth, black air, and with the ribs interposing there. And so again, just showing that the lung tissue has collapsed down about midway down. And then again, another deeper look there, nice and smooth compared to the other side. There we go. Nice and smooth. That's the area of demarcation there. Another blown out further picture. Air pocket right there. Chest cavity. Now after we put the chest tube in, the lung has re-expanded, and that space that used to be nice and smooth now is the same as the other side, with some streaks and such. That means that the lung has re-expanded and filled up in the chest cavity. This is a little bit rotated where the chest x-ray where it was taken, but again you can see that area where it was nice and smooth, now it is kind of opaque with some lung tissue there. So the lung has re-expanded. Throughout this whole time, he was experiencing some chest discomfort, chest pain, to be expected. Again, that's just a little bit closer view of the area that was re-expanded. Again, you don't have that nice and smooth texture. Well, hopefully this helps. This is a example of a possible complication from a procedure. The pneumothorax or air leakage is a uncommon complication, but it can happen. And so it was treated with a chest tube, and the patient did well in recovering, and we'll be going to skilled nursing home soon. So, all right, thanks for watching. Hopefully this helps. Take care. Bye.